Hi again, everybody. This is Dr. Tim Newton with Inspire Movement Physical Therapy. Today in this video, we're going to show you how we treat restrictions in the upper cervical spine. That is where the upper neck meets the base of the skull. Why would we want to treat this area? Well, for one, if you have pain there, but also we would want to treat it with anyone who has any kind of TMJ dysfunction, any kind of headache, facial pain, or even migraines. Okay, so now we're going to show you how we treat the upper cervical spine. Specifically, we're going to treat where the top of the cervical spine, which is the neck, meets the bottom of the skull, okay? This is called the occipito-atlantal joint, otherwise known as the OA joint, for you anatomy buffs out there. So first, as always, we want to do a good assessment and figure out exactly how things are moving, where things are restricted, if they're restricted at all. So I just cradle the back of her head in my hands. And to test the right side, we're going to turn her to the right a little bit. And I'm just moving her like this. It's very important that the patient can relax in this position. Sometimes it's harder for people to do. Okay, and I feel how things are moving on the right. And I feel how things are moving on the left. I do notice a slight bit of asymmetry. Her movement is fairly good, but the left side does not appear to want to extend backward the same as it does on the right. Another thing that's good for me in diagnosis is feeling just with my hands in the area, is there more muscle tension in that area? For people who have pain in this part of their spine, at the base of the skull, muscle tension is a very noticeable thing. And I feel a tiny bit of asymmetry here, okay? So I want to treat the restriction that I found. Again, that's tipping back and kind of to the left, so that's what we're going to do. So I take her to the direction where she doesn't go as far, and I take her as far as the joint lets me. I am not trying to overpower this thing. I'm not trying to twist her up like a pretzel. I've got my hand on that joint. I'm feeling exactly how far it wants to go and where it stops, and I'm not taking it any farther. So I'm taking it up to that barrier of motion. I'm actually going to back off that just a little bit, just so I'm not overpowering the joint. Are you doing okay here?
I'm doing fine.
Okay, so we also don't want pain. We're trying to avoid that. And now I'm going to ask her to go ahead and look down and to the right with your eyes and your eyes only. Not turning the head, just using the eyes. And hold that gaze. As she's holding this gaze, you're probably wondering, why are we using eye movement here? Relax the eyes. As she's looking with her eyes, and as we all look with our eyes, we get these tiny, reflexive contractions of our neck muscles that accompany it. It's a built-in reflex. Once you start turning your eyes one way or the other, the neck reflexively kicks in to join it in a movement. So what we're doing here is we're taking advantage of these tiny little bits of neck muscle activity. Go ahead and look down and to the right again. And we're getting the neck to contract and relax. Go ahead and relax that gaze. After the neck is done contracting its muscle via the eye movement reflex, look down and to the right again, we get something that's called post-isometric relaxation. And what that really means is that the muscle is a little bit extra relaxed after it's finished contracting. And we take advantage of this extra relaxation because it makes the joint just a little bit more pliable, a little bit more flexible. Relax the eyes. And after every time she's looking, every time her muscles are contracting a little bit, I take that joint just a tiny bit farther. It's very hard to see exactly how much this is because the movements are very small. We're not trying to twist her whole neck back. We're very focused in where we're working here. One last time, go look down and to the right and relax. Okay, so I'm no longer gaining more motion. So this technique is complete, okay? I just want to double check, as always, to make sure that we did in fact move and mobilize this segment like we had intended. So I go back and I'm testing her right side again. That feels about the same. Now the left side, this is the area that we were working on. And she comes up a little bit farther. So that was a successful treatment. We got a little bit more mobility at the OA joint, okay? That's where the base of the skull meets the top of the neck. Okay, so that was a treatment of the upper cervical spine. If you found this video helpful, subscribe, leave a comment, or check out our website, marylandmanualtherapy.com. Thank you, and have an inspired day.